Hello, everybody.
Hello. We're just waiting for everyone to join. We'll be starting in like a minute.
Hi, Carly. How are you?
I'm good. How are you?
I'm good. Hopefully everybody's not working too hard today.
All the brides are signing on right now,
All right, that's exactly right.
like Carly here.
Yeah. All right, we're a minute in. Should we get started?
You ready? We're good?
All right. Well, welcome everybody. We are going to be discussing all things about getting wedding ready. You don't necessarily have to be a bride-to-be, whether you're the mother of the bride, if you have any family reunions, big events coming up. The purpose of us coming on today is just to share a general timeline of all things that you can do to get ready for your big event.
Perfect.
So I am Carly. I am your aesthetic nurse injector here at our Quintessa Sheboygan location. I've been injecting for about 8 years now, and I do all things aesthetics, which we will get into. Most of those would be all of our neurotoxins, which we carry Botox, Dysport, and Daxi, and then all of our fillers here as well. And those brands that we carry are Juvederm, Restylane, and the RHA collection of filler.
Hi, I'm Shelly, everyone. I have the privilege and honor to work in our Sheboygan location, performing all the laser treatments that we do here, like BBL, halo, hair removal, cool sculpting, chemical peel, skin pen, which is microneedling, all the way up to like the diamond glow.
Woohoo. So the importance of skin prep for your wedding day. So essentially, we would love all of our patients to have a medical grade skincare regimen that they're currently on. Mm-hmm. Being on a medical grade skincare routine will help enhance your results. It'll help lessen your downtime. Biggest thing that I like to point out as a provider is that we do have 2 classes of skincare routines that you can be on. You have a pharmaceutical grade and you have cosmeceutical. Think cosmeceutical is anything that you can get over the counter, whether that be Sephora, Ulta, Rodan & Fields, Mary Kay, some of those brands. They essentially go unregulated by the FDA, meaning that companies can put whatever they want into the tiny little jar, make it nice and cute, market it to you, put whatever price tag they want onto it, but they don't necessarily have to guarantee that those products or those ingredients are in that little bottle. Mm-hmm. Anything that you'll purchase from us from a medical grade standpoint, we do have to have a physician that orders these, which means that you will have stronger active ingredients, better quality, and all of the products that we do carry do go FDA regulated, and they are studied to prove their efficacy.
Yeah, super important in the skincare. It's your foundation, and it's essential in just extending all the things that we do here as well. So
get on them.
Get on it.
All right, we're going to jump right into the role of injectables to get you wedding ready. So first and foremost, and probably our most popular service that we provide here are our neurotoxins, which would be Botox, Dysport, and Daxi. If you ever come in for a consult, we can kind of go through the differences of all of the services that we provide here, but essentially these treatments relax muscle contraction. For example, most 3 common areas that people are treating is the glabella between the eyebrows, which gives you the 11s, our upper forehead called the frontalis, which when we raise our eyebrows up, it gives us horizontal lines, and then the crow's feet around the eye. So when we smile, it kind of creates that little bunching effect. So those 3 areas do interdigitate. They work together, so it's nice to relax them all. Everybody is going to need a little bit of a different dose, but realistically, people are going to come in about every 3 to 4 months for those treatments. For me personally, one of my favorite treatments is axillary or armpit Botox for hyperhidrosis. I'm actually going to be a March 2026 bride in Cabo. It's going to be hot, so you know that I'll have my armpits treated before I'm walking down the aisle. Second most common would be dermafillers. Dermafillers are a hyaluronic acid gel, so kind of think they're actually giving volume to the tissue, and they pretty much mimic the fat pads that we start to lose as we age. We truly start aging in our early 20s, so we lose about 1 ml of volume per year. So you can kind of adjust how many syringes or mLs you'll need based on how old you are, what you've done in the past. Some common areas are temple filler, cheek filler, under eyes, nasolabial folds, lips, jawline. Me personally, I do filler about once a year. I've had my cheeks done, a little bit to my under eyes, lips, jawline. So I will be doing that a few months before the wedding as well. Next would be Sculptra, which is a biostimulator. Essentially, we inject this into the skin, and a few weeks to months later, your body is actually going to start stimulating more collagen. It's great for big or larger areas. So again, temples, kind of submalar. If you've lost a lot of weight and you're kind of noticing that gaunt and hollowness to the lower face, it's an excellent treatment for that area. It does take a little bit longer to stimulate collagen, so it's something that you'll want to do a series into. Again, if you come in for a consult, I can let you know how many vials and what your time frame would look like, but it's great. And then lastly would be Skin Vive, which is essentially a skin booster or injectable moisturizer. I always explain a lot of times it's more like an emotional treatment, so we'll inject it essentially eyes all the way down to the jawline. We can put it into the neck and the décolleté area. More so, you don't have that internal dryness, but about 1 month after treatment, you'll visibly have this nice glow to the skin. As far as the timeline, we sort of went over this, but again, your neurotoxins or your Botox, you're going to be doing about every 3 to 4 months. I would not suggest having your first treatment be right before your wedding. If you do have resting lines, we definitely want to kickstart and do several treatments before the big day so that those lines can soften. Botox is not a magic eraser. It relaxes the muscle. If the muscles relax, the skin then has time to repair and heal itself. You'll see Shelly for lasers. You'll be on a medical grade system, so that will all in combination help. It's not a one and done treatment. It's that cumulative effect of if we keep that muscle relaxed, your skin can't continuously pull in and it can't break that skin down. Fillers, again, everybody's different. I would not suggest doing your first filler treatment right before a wedding. Try something out. Figure out your downtime as far as swelling and bruising, which every time can be a little bit different. Realistically, you'll probably want to do that 3 to 4 months before your big day. Fillers truly integrate within the tissue at about day 21 or a month after. So kind of have that as your mental note of when to do this. But 3 to 4 months, I feel like, is a great place to start. Sculptra, again, that's the one that's going to build up collagen over time. So we want to start it even further ahead. I say it's like your 401k investment. You'll keep doing it, you'll build it up, and then Sculptra will last a lot longer. So 6, 9, 12 months before your big day would be a great place. And then lastly, Skin Vive is best 1 to 2 months before. So remembering that Skin Vive's full effect is at about 4 weeks after treatment to visibly see some hydration. So we're going to get into some before and afters. So you can see on the left, this patient had her glabella treated. So the top picture is her before, trying to animate and make that angry face. The bottom is 2 weeks after. So you can see she can't pull in. You can see her skin's laying a little bit more smooth. She has a nice little glow to her skin. Picture on the right is somebody that had her glabella and her frontalis done, but this photo is showing her raising her eyebrows high. She still can raise up high. She still has a nice arch to her eyebrow, but when she raises up, she doesn't have all of the bunching to the upper forehead. And then again, crow's feet, third most common area. So we inject right around the eye. It kind of opens the eye up. In this particular patient, you can see that she even got a nice little brow lift. So in her before, you can see that her brow is kind of trailing down, and then her after, she's starting to develop a little bit of that nice arch. She can still smile. You can still tell that she's smiling. She just doesn't have as many lines around the eyes. And here's just some other images. So again, nice eyebrow lift. She's still smiling. It won't affect your smile by any means. And then last photo. So filler. So this patient had about 7 mLs worth of volume in her face. To a lot of people, that might sound like a lot. 5 syringes is the equivalent to 1 teaspoon. So my goal as an injector is I never want somebody to know what you've had done. Nobody should come up to you and say, hey, where did you get your cheeks done? Where did you get your jawline filler done? It should go unnoticed. So that's always our main goal. So this patient had a little bit into her cheeks. You can see she has just a little bit more of a highlight to her cheeks, which looked nice. Her lower face to me is kind of that is an excellent after result of the corner of her mouth is just picked up a little bit. She doesn't look as sad, but again, she's still very natural, has a nice lift to her face, and we're kind of starting to age in reverse now. This patient came in, she was bothered more so by her extended crow's feet lines, which means that when she smiles, those lines kind of went over her cheek. So we did a little bit of cheek filler again, and then we just kind of blended the transition of her lower face because she was more so bothered by these lines when she smiled. Again, if you take a peek at her cheek there, you can see just a nice highlight. Those lines that went down her cheek are pretty much gone, and she still looks like herself and very natural, and she had just over 6 mLs, so 6 syringes. Moving on, lip fillers, probably our number one area. So again, this patient had a nice lip shape to begin with. But you can also tell that her lips just kind of trailing down more into that sad appearance. So we kind of picked up the corners. We gave her just a nice border and definition with some hydration. This was immediately after too, so she was swollen. So 1 syringe of lip filler should not look unnatural. It should not make you look ducky. Again, just a very natural result. Next category is Skin Bead. So that's that injectable skin moisturizer. You can see, again, just a nice little highlight across this patient's cheek. A lot of times Skin Bead is that emotional treatment of that you just internally feel hydrated, but about a month after you can visibly see improved texture to the skin, a little bit more of that glow, a little bit more of that dewy aspect to the skin. And here's another example. Again, I feel like a lot of people just pick up a nice highlight on their cheek.
Mm-hmm.
All right, and Shelly.
That's me. All right, so lasers, what role do they play in our skin? A lot. So basically, BBL, broadband light, is filtered light. Typically what we're going to do that for is redness, so anything vascular, broken capillaries. Sun damage is huge, so if you have any pigmentation concerns. So basically what BBL is just going to overall brighten our skin, even out our skin tone. Simple, we'll go over the downtime on that, but really nothing. Halo laser, love it. Those two are my favorite go-tos. Halo is amazing, dual laser that resurfaces and profractional, so it's plumping our skin, so fine lines, wrinkles, tone, and texture. And then laser hair removal. Throw those razors away for your honeymoon, and you bikini, underarms, legs. Amazing treatment to do. And finish up with an awesome Diamond Glow. Refreshes the skin, makes our skin glow for that exfoliate, deep clean.
It's kind of, don't they say it's kind of like a carpet cleaner? Like
Yeah.
you suck the gunk out and you infuse all the good stuff and you're just glowy.
Beautiful. Our timeline, this is totally flexible. So BBL, we love it if you can do it twice a year, but for a bride, don't come in the month of your wedding, but we do like 6 to 12 months. Come in for that consult. Halo, the same thing. Come in, do one a year, do one even the month of your wedding would be great. We'll talk about that. I think everything is customized per the person, the individual, whether you're 30 or 60. It's going to depend on that. Laser hair removal, it's a process, so you have to start that early, 6 to 8 sessions, so you do need to start that like almost 9 months to a year ahead. And Diamond Glow looks great the week of. I definitely do it and keep going. All these treatments that you do is something that you want to continue to do. It's a great picture of vascularity, so redness with that BBL. What a great treatment that she got from that. I love that. And then the next one I think is, so this is Halo and BBL. So again, that texture of the skin, the pigmentation on those cheeks, overall just glowy skin. It's a great treatment. We kind of went over this. So wedding timeline. So 6 months before, we kind of wanted to start those laser treatments, BBL, Halo. And again, come in and talk to us and we will detail everything for you. So
Well, I think for us too, we can pick me as an example. Shelly and I both had our annual Halos a month ago.
Just a month.
Yeah, a couple days, maybe a week of downtime is truly not too bad, but
it really is not bad. And then your skin just feels so smooth. It's beautiful. Baby's bottom. Really nice.
So let's see. So I do my halo once a year. BBLs I'll probably do twice a year.
Oh, for
twice a year.
BBL twice a year for sure, but like wedding wise for you, we did your halo. We'll probably do another halo and a BBL for her before.
I'm an avid sunscreen user, but as you know, if you're in the sun, heat can produce some of that brown pigment as well. So it's always nice to clean it up in fall, winter, prep for the next summer. So BBLs twice a year. As far as your neurotoxins, so Botox, Dysport, Daxi, every 3 to 4 months. You essentially want to do your next treatment before full movement is back, so everybody's a little bit different. I have been doing Botox for 8 years. I think I started when I was 25. I feel like I'm about every 4 months now. At first, I was every 3 months ritually. And then filler, again, 1, 2, 3, probably 2 to 3 months before the wedding, if not a little bit ahead of time, just to prepare for a little bit of swelling and bruising. And then skin beef treatments again, so that visible skincare booster, or skin injectable booster.
And then even like for the BBL, if brides especially, if you have dresses that you're exposing your shoulders, chest, back, BBL halo that, it'll just be beautiful.
You can BBL anywhere.
You can BBL
face,
anywhere.
Neck, chest, arms, hands, legs.
Halo too. You could halo anywhere, but if you're doing that, you have that beautiful chest.
Right.
You're exposing that dress. The other thing was cool sculpting. I had two brides this year that had their dress.
Like the little bra
and they had a little bra fat here, and they didn't like that. And they came in and we did a little cool sculpting here.
Mm-hmm. You can do the backs too, right?
And we did her back and we did her front and we did one of the brides was her arms. Beautiful. She looked great. I can't wait to see the end result for her in her dress. But just a side note on that. But BBL anywhere, shoulders,
face,
halo,
neck, and chest should all match.
Yeah.
Especially hands too.
Yeah. And this goes for moms,
pictures.
like mother of the brides.
Mm-hmm.
Grandmas, because grandmas are young now, so
they love it.
Yeah.
And then a week before, again, your diamond glows, get wedding ready, have your skin be nice and glowing. So that's kind of our wedding timeline. Some FAQs. How long do Botox and Daxify take to work? Most of our neurotoxins kick in about 1 to 5 days. Full effect, where I'll see patients back to evaluate their results, are about 2 to 3 weeks. And again, you're doing those every 3 to 4 months. Will fillers make me look unnatural? If we put the right product in the right plane of your face, absolutely not. That is our goal. Again, we don't want anybody to be walking around looking unnatural. That's never our goal. You're also a walking advertisement of our work, so we don't want people to say,
absolutely,
Shelly, where'd you get your cheeks done? I can tell that you've had them done. So that's never our goal. Natural is always our goal.
Correct.
How long do injectables last? So again, your neurotoxins are 3 to 4 months. Filler can be anywhere from 6 months to 1.5 years, 2 years, depending what area we do. Fillers are not created equal. We have fillers that go into the lips that are very soft and kind of malleable and squishy because we don't want hard, ducky lips. Those are typically the first to go. And then we have areas such as our jawline and our cheeks that almost mimic our bones. So they're a little bit more robust and they're thicker, where those ones typically last a little bit longer, up to 1 year. Most patients are doing filler treatments about once a year. Sometimes people do like to top their lips off a little bit sooner if they're a person that metabolizes it a little quicker. Do injectables hurt? I always say pain is subjective. Mm-hmm. I think I've had one person in my 8 years tell me to stop and then it was too painful. She got through it and now she's back every 6 months to 1 year. So realistically, we'll use topical numbing. We can block you if absolutely necessary. So again, we want you to be your most comfortable. Mm-hmm. However, we do have to realize we're sticking a little baby needle in the face, which probably will never ever feel pleasant, but it is very tolerable.
Okay, so question is, how many laser sessions do I need? Again, that's subjective to who you are, like what it is that we're looking to correct. Yeah. Your age.
Were you a tanner? Were you a smoker? Yeah. What are we doing outside of our 4 walls of Quintessa?
So I say to anybody, it could be, 3 treatments, but we'll go over that again when you're in that chair and we're talking and we're looking at what your concerns, your needs are. Downtime, is there any downtime to laser treatments? Some do, like the broadband light. I say that really isn't downtime at all. I think if you have pigmentation that's going to turn darker, but you can put makeup on that, cover that up. So I don't feel like the broadband light, you are down at all. Some other treatments that we do with that laser, like the halo, a couple days of maybe some slight swelling. But again, the skincare that we give you to use will really help hydrate your skin. So I feel like you can cover that up relatively easy. How soon will I see results? 7 days. As soon as 7 days, some maybe even sooner, but 7 days you'll start to see that glowy skin.
Yeah.
Especially the halo, the last one I had, I couldn't believe it. It was just like so bright within that 7 days.
Yeah. Well, and you stimulate collagen with the halo too, right? So
both of them.
Months down the road.
Both of them, yeah. You definitely stimulate that collagen. So the results for anything that we do is like a month to 3 months, because that's how long collagen takes, but they last. I mean, you're definitely going to see those results ongoing, continually, I should say. Can I wear makeup? Yes, you actually can. Usually I'll say 24 hours you can put some makeup on, but you definitely can do that to hide some of the pigmentation.
Yeah. And that's the same rule with fillers as well. No makeup for 24 hours. After that, do whatever you want.
And sunblock. I can't stress that enough. Sunblock.
All right.
If you guys have any questions for us, definitely type away and we'll see if we can answer them. If not, you can reach out to us, Carly or myself here in the Sheboygan location, but we have 4 other locations that do exactly what we do. So reach out to one of them. We have some great providers that will also be able to answer all the questions that you have and sit one-on-one. Basically, what we really do here, which I love, is it's all about you. So we sit down and we really talk to you about what your concerns are, what your ultimate goals are, and then we design that plan specifically for you. Nobody's cookie cutter.
And it's complimentary, yeah.
And it's complimentary,
There's never a pressure to book. If you want to come in, have your full face
chit-chat.
body assessed, we're more than happy to send you with your plan. And when you are ready to start your journey, we'll be here.
And we have fun. Just come in and have a cup of coffee with us. Just hang out. Right, Vanna? We're fun.
So we don't have any questions so far.
That's okay.
No questions.
That's because everyone's knowledgeable, right?
Yes.
Because we love
We already answered everybody's
We
questions.
answered. Now, honestly, it's like wedding prep, like you said, for you, 101. Carly's a perfect example.
Yeah. I mean, I have been in the field for a while, so I maybe have a little bit of an advantage, but even for me being in the field for 8 years, I'm already trying to come up with my timeline of when to do what.
And we were talking about that not that long ago.
Yeah.
And then this came up, so it's kind of fun.
It is. All right, last but not...
Just 1 more minute.
Okay.
What else? What do you have? So many fun things, honestly.
Yeah.
That we could do for your wedding. And like I think we touched on, it doesn't just have to be a wedding. This could be for anything.
Any event.
And it can be grooms too.
Absolutely.
Dads, grooms, that you can do all these things for too.
We do referral programs as well. So if you do have a whole wedding party that wants to come in, we offer $100 off for you and whoever you've referred. You get $50 off the month of your birthday. And then we also have a Quintessa reward system too that we can utilize.
So definitely.
No questions?
Well, thank you very much for joining us today. Everyone have a great day.
We will be announcing our raffle winner tonight at 6 o'clock. Thank you for everybody for taking time out of your day to listen with us. We hope to all see you soon for a consult. Send any questions our way, and we hope to see you all soon. Bye.
Now's when you need the music. Cue the music.
Cue the music.